Greetings, I am Ariel D. Ward. This is my stakeholder presentation on a teen pregnancy prevention program called Better Aware. Time for a brief introduction and overview of our program and background information. Teen pregnancy rates have steadily declined in the United States since the 1990s. However, they still remain the highest in the world. In the United States, Florida has had 16.7 births per 1,000 females, being those that are aged 15 to 19 years old. In Florida, Leon County is ranked 23 for the highest teen pregnancy rate in births. The priority population for this program are women ages 15 through 19 residing in Leon County, Florida, primarily African American and Hispanic population. Those are the women that have the highest rate for teen pregnancy in the county. Economic status rating from low to middle class. Now we will go over the mission goals and objectives. To educate adolescent females in Leon County is our mission. We will be educating them on reproductive and sexual health while providing preventative measures and activities to reduce the rate of teen pregnancy. Goals for this program are to reduce the rate of teen pregnancy in Leon County, increase education in adolescent females on reproductive and sexual health. The objective for this program is in the next year, the rate of teen pregnancy will be reduced by 10 to 20%, and participants will be able to demonstrate preventative measures after attending the program. The program planning model, I will allow you all to read over phases 1, 2, 3. Phase 1 is mobilizing. We will partner with local health departments, pharmacies, clinics, and religious organizations. We will provide community outreach. This will form our education coalition and allow us to do community outreach where it needs assessment. Phase 2, of course, who is affected, teens in Leon County, Florida. Resources would be current preventative education and resources at local pharmacies and clinics. Plan would be to measure. What we're measuring is the decrease in teen pregnancy rates in Leon County, Florida. Phase 4, participants will be reached out by community outreach, flyers, through social media marketing, and through youth and community organization programs. Phase 5 will be to track our progress, and of course, at every stage of program planning, we will track our progress. This is our behavior change theory. This diagram is the information motivation behavioral skills model. The use of the IMB model will have an impact on teens participating in the prevention program. Presenting them with knowledge and information about sexual and reproductive health and the consequences that come with adolescent pregnancy will affect their prevention behavior. Expanding their knowledge on preventative measures and resources enhances their motivation while enhancing their skills. Prior to program planning and surveys and questionnaires, these can be implemented to help and guide program planners enforce what the participants would like to be educated on and determine areas of weakness. From there, planners will be able to evaluate and make and develop interventions to determine how successful they and the program will be. This will also help determine if the interventions are successful and significant to the priority population. and will affect their needs, motivations, behaviors, and preventative skills. Intervention for the program. Interventions include the promotion and the development of educational programs within clinics, local health departments, and pharmacies, provide mentorship programs for social support and development, promote peer education with faith-based organizations in churches for testimonials, and this will be through the Alpha Omega Miracle Home. Promote healthy reproductive and sexual health practices on social media pages. This goes into our marketing, which will be discussed later on. Resources include personal resources, not personal, personnel, employees from local health departments, free clinics, pharmacies, churches, and religious groups. Other resources will include pamphlets and brochures from the health department, clinics, pharmacies, and churches. Examples of our religious support groups would be from Bethel Missionary Baptist Church of Young County, Florida, and again, the Alpha Omega Miracle Home of St. Augustine, Florida. This is our timeline beginning in December of 2020. Planning and sponsorship letters will go out January through February of 2021. Community and priority population will receive their questionnaires and surveys. This will be a part of our needs assessment. In spring 2021, the program will begin, and there on out, we will then partner with the Leon County Health Department to track the progress of teen births and pregnancies. Policy implementation, we will reinforce the Florida state statutes that are listed below. Marketing, our main focus would be how to reach out to the young women. We will definitely be using social media since, teenagers are very much glued to their phone. Our social media campaigns would include making challenges to popular trends on sites like TikToks and using hashtags on Instagram. There will also be a volunteer speaker to visit church and youth organizations to advertise the program and register participants. Ethics, of course, there's always going to be areas of concerns. Then those lie where there is a discussion on sexual abuse or religious resources that participants are given. And also there are confidentiality issues. There are, things such as HIPAA violations that could occur. This is the logic model. And this is our program summary. Teen pregnancy prevention program should focus on behavior changes. Discussion on sexual and reproductive health is important and effective in teen pregnancy prevention. And we are going to be focused on remaining abstinent and abstaining from sexual activity to improve sexual health and reducing pregnancy rates amongst teens. And these are our references. Thank you so much for listening to my presentation. I really do appreciate it. And thank you, Dr. Wheeler, for taking the time out to help us learn. Thank you for all your help throughout the semester. It was greatly appreciated. Thank you. Bye.